So, the purpose of today's session is to obviously share findings from our research project, to reflect on how MI is currently being used in children and family social work, and to explore implications for ethical anti-oppressive practice. So, why MI? As a social worker working in an assessment team at the time, a very fast-paced environment, I valued that MI aligned with my practice values. I found through my action research project that it helped building relationships with parents to feel more included in the assessment process. It was also successful in managing difficult conversations and moments which could otherwise lead to conflict. Also, it's used and encouraged by local authorities as a practice model that they want social workers to use. So something that we noticed was the gap between what MI assumes and the reality of statutory children's social care. So MI is built on some key assumptions: that people can choose whether and how to change, that motivation can be drawn out rather than imposed, and that the behaviours that we focus on are meaningful and achievable. But we're working in a very different context. Much of our work is compulsory, especially in a child protection setting. And the consequences of not changing for families are really serious. So compounding this, many families are also living with poverty, housing insecurity, and service gaps. So I think the tension here isn't that MI is wrong, it's just that the assumptions don't always fit the reality in which we're working. And that's kind of what we really need to hold in mind as we're using it.
So when we think about the reality in which we're working, we need to look a little bit wider and think about the political context, the social context within which we work. So I think we could argue we're leaving a neoliberal society at the minute, but neoliberal values are still really prominent in our society. So neoliberal values stem from Thatcher and Reagan in the 80s, but have become very dominant in America, England, and maybe to a less extent in Europe. But they argue that market forces create an efficient society. Cream will rise to the top, and things people don't like will close, won't be needed. So as part of this, individuals are encouraged to compete against each other in a perceived meritocracy. The liberal in neoliberalism is really about the idea that we're free of state interference that risks constraining markets and entrepreneurship. So neoliberals argue that we should have a small state with limited public spending, low welfare, low taxes. And probably the most dramatic example you can see of that in the UK is the austerity agenda brought in by the coalition government in 2012. So this argued for huge reductions in welfare, huge reductions in public spending, and it's led to huge gaps in inequality between rich and poor and significant increases in poverty. And with this idea of this meritocracy, of the idea that people should compete against each other, comes the idea of responsibilization. Responsibilization being that it's people's responsibility to manage their own issues and problems. It's not the role of the state to step in when there are difficulties. So this is a very famous quote from Michael Gove, who was the Home Secretary at the time of the coalition government. It's a speech he gave to the NSPCC. So this was a very important speech in that it really set out the political theory that supported the government at the time. And what Gove is saying is that we should not be linking people's behaviour to inequality and social injustice. That doing this breaks the link between agency and people's actions and consequences, and that it risks saying that things like domestic abuse, substance abuse are the result of inequality rather than people's own behaviour. But when we look at the reality of child abuse and neglect, shortened to CAN here, child abuse and neglect, what we can see is there is a very clear correlation between poverty and child abuse and neglect. So contrary to what Michael Gove is suggesting, structural factors do make a difference, make a significant difference. And there's a number of research papers that are cited here. I'd imagine if you've done the Frontline programme, you'll have come across a few of these. So Paul Bywater's Nuffield sponsored project It's one of the largest social work research projects undertaken in the country, and it showed that children in deprived areas were 35 times more likely to be subject to a child protection plan, or 8 times more likely to be removed from the care of their immediate family. So this is showing very clearly that there is a link between structural inequality, poverty, and issues that result in child abuse and neglect, contrary to what Mr. Gove might say. Well, we don't know exactly what this causal link is, and we need to be a bit careful here, because all families that experience poverty do not experience child abuse and neglect. So we need to be careful of having a very linear, reductionist connection between the two. But it's thought that it's factors like stress and shame that limit our parenting capacity when we're in poverty. It's hard to keep your children in mind, maybe to mentalise them if you're worried you're going to get evicted. It's harder if you aren't able to provide for your child's basic needs, where you see others in your community being able to do so. That creates shame and stress and reduces your parenting capacity.
Fab. So thinking about some families that I have worked with then and used in my action research project, the first family that I wanted to speak about today was the Burton family. So they were referred to Children's Social Services following a physical altercation at home between two siblings. Mum, Emily, tried to intervene and was assaulted by her son, Alfie, who has diagnoses of ASD and ADHD. In the moment, she bit him to get him off her, something that she later expressed a lot of regret about. Alfie's behaviour was a key concern, but it was happening in a really pressured context. The family were living on a 5th floor of a high-rise flat, which was cramped and unsafe, particularly given Alfie's needs. Emily was also waiting for a paediatric review for Alfie's ADHD medication, and this was 6 months overdue. The family weren't working and they were relying on benefits. So when the case was allocated, the presenting issue was framed as a parenting challenge, and I used motivational interviewing to explore Emily's confidence and capacity. So together we identified a target behaviour around her ambivalence about attending a specialist parenting programme. I used affirmations, open questions, and change talk to support her through this, and she did agree to enrol. But I think what's really important is what happened next for this family. So before Emily started the parenting programme, Alfie had his medication review. Over the weeks that followed, the concerns really diminished, and a decision was made that the family no longer met threshold for support. Children's Services subsequently ceased their involvement with the family prior to the start of the parenting programme. So reflecting on this, I really began to question what MI had actually been targeting. Emily wasn't unwilling to parent or resistant to support, and the biggest drivers of stress were delayed health services and unsuitable housing. So by focusing on her behaviour, MI risked placing responsibility on her to change, whilst those structural factors stayed largely in the background. So I think the tension that this case highlights is not that MI was used badly, but that without a critical lens, it can really pull our focus away from the systems that are actually shaping family life. And the other family that I wanted to speak about today was the D'Souza family. So Maya and her husband are second-generation Indian Catholic immigrants. Children's Services became involved after her husband assaulted their daughter, Ria. Maya later disclosed that he'd also been abusive towards her. Initially, Maya engaged with a domestic abuse practitioner and ceased contact with her husband. However, the situation was really complex. Both parents were working full-time, and although her husband had moved out, he continued to support the family financially, and that financial dependency made separation much harder. Once he left the family home, he had no access to housing support and was living with extended family. Over time, Maya restarted telephone contact with her husband and stopped attending appointments with the domestic abuse practitioner. And now this really raised concerns about ongoing risk for the children. So using motivational interviewing with this family, I worked with Maya to explore the pros and cons of contact with her husband. Once the relationship felt established, we identified a target behaviour around re-engaging with domestic abuse support. I used MI techniques to try and elicit change talk around recommitting to that work. Maya expressed disdain talk, explaining that her priority at that point was supporting her children emotionally rather than focusing on her own needs. So, reflecting on this, I became increasingly uncomfortable with how responsibility was being located. Re-engaging with domestic abuse services would almost certainly have pushed Maya towards leaving her husband, but that choice involved serious material and emotional losses, particularly and potentially, entering a refuge, the children changing schools, and losing financial stability, becoming reliant on benefits. So in practice, the focus on MI risks shifting responsibility for safety onto Maya rather than onto the perpetrator or onto the local authority to address housing and financial security. It also risked overlooking how racism and immigration-related marginalisation may have compounded her lack of real options. So this really led me to question whether the chosen target behaviour was actually ethical in that moment. I shifted my focus from supporting the family with housing and stability, knowing that Maya was aware of how to access domestic abuse support if and when she was ready. So moving on to some of our key findings then, we found that there were three main things that we kind of pulled out from our research. So the first, which Henry's already mentioned, is this idea of responsibilisation. So when MI is used uncritically in statutory settings, it can unintentionally reinforce the idea that individuals are responsible for fixing problems that are actually shaped by poverty, housing, or service failures. The second is illusions of autonomy. So this idea that MI assumes choice, but poverty restricts what choices are realistically available. And there's a risk that we overinstate agency when people are navigating very constrained options. And the third is shame and disengagement. So when change doesn't happen and the focus has been on individual motivation, families can kind of internalize that as a personal failure, and that can increase shame and actually make engagement harder, not easier. So again, these aren't arguments against MI, but reminders of what can happen if we don't use them critically. So what does this mean for practice then and for using MI ethically? I think the first and main point is that MI can't really be used as a standalone practice model in children's social care. And on its own, it risks narrowing our behaviour. It risks narrowing our focus to behaviour when the drivers of risk are often structural. When we do use MI, we need to be really careful about what we define as target behaviour. It needs to be genuinely achievable and meaningful, and it mustn't act as a substitute for things like housing, income, or access to services. That means naming structural issues explicitly rather than leaving them in the background of the conversation. Ethical MI in this context has to sit alongside poverty-aware practice, active advocacy, and material support, not instead of them. And finally, none of this works without critical reflection and supervision. MI is relational and powerful, and without its spaces to reflect on how we're using it, it's easy for it to drift away from social work values.
So, some questions I think we would like you to think of if you're using MI. A critical use of MI would ask, what options does this person genuinely have? Am I responsibilising them based on things that are the result of structural issues? What could make change more possible? Are there things that are external to that person in their community, in their networks, that also need to change? Again, MI is a theory that's used to support autonomy and to help people look at their ambivalence around a decision. It's not a risk management tool, and it shouldn't be used like that. At what point do material and systemic support need to come first? Again, the two examples that Nina gave were very vivid of two people who had significant structural issues around them, both indirectly or directly related to poverty. Does this need to be addressed first? And also, it's my use of MI likely to create this shame for people or double suffering. So double suffering being the idea that someone in poverty is positioned in a way that assumes that they are in a meritocracy and that they have the same options and autonomy and agency as someone who's not in poverty. And ignoring that creates this idea of double suffering, that we ignore the problems that they face. So we must remember that MI is at its most ethical when we expand choices, moving beyond just exploring motivation for a change that may be motivated more by children's services than by a family or a service user.
Thank you, Nina. Thank you, Henry. Really interesting presentation. And I'm sure that the audience that are listening will have a number of questions to put to you. So we'll just wait for them to come through and then I'll put them to you. There's a question just about the references. And so certainly Henry's just about to share that. So that's an open access article. Is that correct, Henry, in terms of, so very recent in terms of, if you're interested in learning more about this. So, yeah, that's certainly open. And we will also share the slides from the presentation as well. Just before we get any questions, just reflections, Nina, for you in terms of what would you, obviously you've held a critical position, but what would you say you took from the positives in terms of using MI with the families, in terms of the benefits to that approach alongside a more kind of critical position? How do you think it helped you engage with, the families?
I think, as I was kind of saying earlier, at its core, MI is a really sort of great relational tool in helping families feel like they're really collaborating with you, they're kind of on your level, and that I really found that it kind of helped that relationship building piece. I mean, my research initially kind of started off as thinking about how I'm using MI in the context of working in a really fast-paced environment in the assessment team, where I was working at the time, where, you're kind of entering a family's life at a point of real crisis and wanting to really understand them in a really short space of time, and actually kind of being a bit critical about using, open questions, really making a family feel heard and listened to, I think was the sort of main thing that I took from using MI in my practice. And I think I really saw the real difference that it made in helping families felt like they were with me on that journey and really understanding, whatever support was being put in place was, being made with them. And they kind of really felt that that was a collaborative process. So, big advocate for MI. I think it's a great tool to use in practice generally.
Brilliant. Thank you for that, Nina. And just thinking about, I suppose, in terms of next steps from your kind of research article, like where do you see the next steps in terms of holding that critical position and more kind of exploration around using MI specifically in child and family social work practice? Obviously, it's been used more broadly in other sectors. What's your thoughts in terms of thinking about its ongoing use in children and families practice for both of you?
Shall I start on that one, Nina? Yeah, look, I think hopefully what's coming across is we're not saying get rid of MI at all. It's very useful. It has its time and a place. And I'd agree with Nina that the core communication skills in MI are really useful for approaching families and gathering engagement. But it needs to be used alongside theory strategies that address the structural issues that families face as well. Poverty-aware practice was an approach that gained a bit of traction a few years ago, where we try to come alongside families and understand their experiences of poverty. I know the DFE have changed their dashboard, the data they collect. For the first time, they are actually looking at family socio-economic position in terms of the data that they create and they monitor, which seems ridiculous that they've never done that before, given that we know the connections between poverty and child abuse and neglect. So that is optimistic, but I think it's about remaining critical and and just try to look at the wider picture. And I would argue as well that there isn't one theory that you can use all the time in social work. You need to have a kind of toolbox of different approaches and just think more broadly about what might be happening.
Thanks, Henry. Nina, did you have anything to add on that one, or got a question from Miriam if you'd like me to pose that to you?
Yes, just
Okay,
reading
no
Miriam's question.
Yeah, so thank you for your question, Miriam. So Miriam asks, what structural barriers in implementing findings from your research have you found? How might these be overcome? And she also just says that she really appreciated your professional experience. That's really great. So what's your thoughts on Miriam's question?
Yeah, I think as we were kind of saying before as well, obviously just really naming those structural barriers and not kind of feeling that responsibility as the children's social worker to kind of hold responsibility for that as well. I think sometimes it's really easy to kind of become really stuck with families when you can see and really empathize with their position, with what's happening. And I think depending on what kind of resources are available to you in, that in the context in which you're working, really naming those within your assessment and you're working with a family. And, I think we're not naive to the fact that there are things that as children's social workers, we don't have any control over. But I think removing that responsibility from the family and kind of being really clear in what the responsibility of the local authority is in this position and also the families and what they're responsible for, I think can kind of help with that as well. I don't know, Henry, if you had anything else that you wanted to say on that point.
I think you've covered it. I think there is at times maybe a pushing back. If I know some local authorities, it can be that they want to push everything through an MI sort of approach, and that they want you to use MI of everything. And it's maybe sharing with your manager about what the structural issues this family are facing, and maybe explaining that shame and is this actually going to be helpful. So yeah, just trying to keep thinking critically around it.
I wonder if there's also something around how you link in with working with kind of other professionals in and around the family in terms of, feeling that sense of responsibility as the social worker to kind of address these much wider, broader issues. I could imagine for somebody that's fairly new to practice, it might feel potentially overwhelming. So do you think there's techniques and strategies in MI that can be used to kind of help engage with professionals and kind of, think around that at all?
Well, I'm not sure. I mean, it's a good point you make about the, being new to practice, and actually you could be very long in the tooth with practice, but it can be a bit daunting, these big structural issues. Kate Morris called poverty the wallpaper of practice, right? It's too big to notice, too small to notice, too often to notice, too big to do anything about. It's there, it's so omnipresent. But I think, I don't know how MI would be useful, but I think it's about making people in decision-making positions in your local authorities just aware of it. Certainly sending a social worker out to do an assessment and maybe having a long-term child and need child protection plan is expensive in itself. There's a cost to that. So if you can make arguments of a spend to save, and that if we could help this family with this issue, we could support them to get some more money, and that might actually be the intervention they need in terms of reducing the stress and the impact of poverty.
Thank you, Henry. There's a couple of comments kind of come through in the chat. There's a question from Hannah which just talks about if you could share some thoughts about what effective supervision regarding the ethical use of MI might look like, and also just thanking you for the presentation. So yeah, any thoughts around kind of that effective supervision?
Should I do that, Nina? That's kind of my ballpark. Hi, Hannah. Lovely to hear from you. I used to work for Frontline Talks as well. I used to work with Hannah. Yeah, good question. So if I'm a supervisor, I think I need to be asking these questions about the family's material position, so to speak. Are they in poverty? What's their living conditions? So I'm trying to get a sense of what are the other causal factors that might be interacting with the risk and harm that have brought this family to our attention. So I think it's very easy just to slip with MI into this sort of behavioural lens of, right, this is the problem, so they're the parents, so what's the target behaviour going to be that's going to address this problem? But just thinking a little bit wider, and I think it brings into the question from Jacob above, which actually is a really good one, is this is really complicated, because I think what Nina's research really gets to is this dilemma and this balance between what is individual responsibility and what is the impact of structural forces. And that's difficult. And I think you're on a hiding nothing if you go too far down either side of that, for me, because clearly people have responsibility for their behaviour, but clearly they're impacted by structural forces. It's about trying to find that balance. So trying to make sure you've weighed up both of those, and really crucially, this psychosocial, how they interact with each other. How is someone's lived experience impacted by poverty? How's that impacting their parenting? Hope that kind of broadly answers both of your questions.
No, that's brilliant. Thank you, Henry. And thank you, Nina and Henry, both for your time today.